Hi, I'm here today at the World Stroke Congress in Montreal, Canada, with Professor Valeria Caso. Can you please tell us more about yourself?
Hello, Jelena. Hello, all. I am a professor of neurology. I'm working in Italy, Perugia. I was the past president of ESO, the European Stroke Organization. I'm still the past president of ESO, of the European Stroke Organization, and my special interest in research is stroke in women.
So, speaking about stroke in women, there are some things and myths and misconceptions about it. So, can we please start from the very beginning? Are there any specific stroke risk factors that are more likely for women to have than men?
Let's say we have to divide the stroke risk factors in sex-related, women-specific risk factors due to their fertility and the end of the fertility, which is the menopause. So pregnancy, the use of oral contraceptive pill, the use of hormone replacement therapy is known to increase the risk of stroke. But on the other hand, it's not only this, because we have the same risk factor as men. So, and even the risk factors are worse for us. For example, we always think that women tend not have hypertension. It's not true, because we tend, as young women, have very low pressure. You know, they always complain. But then, with the menopause, everything changes. We have high blood pressure. We tend to have more obesity, more metabolic syndrome, and these. And we unfortunately smoke. We should not smoke, because normally we should give the good example, and smoking is even worse in women compared to men.
Okay, this is very reassuring that there are factors that we can influence.
Yes.
Because stroke is not something God-given and that cannot be beaten. And
yes.
Okay, finally, we have hope, but it's very difficult to sustain this hope because these risk factors, especially those that are depending on us, like smoking or obesity, are very difficult to very difficult to control. So you said that women are getting more prone to stroke after the menopause. Is there a similar thing that is also related to women and to their medical conditions that they have prior to menopause that might raise risks later on?
Absolutely, yes. For example, women tend to be less fit. Men are much fitter. They tend to have they have better, let's say, muscular tissue. So we tend to move less, we stay more home, and so we always put ourselves as the last point, because first we have to work, then we have our family, and so on. So we don't take our spaces, and this is why we often physically less fit when we come to the second or third part of our age, and this does not help. So I always teach my ladies to take care of themselves, to say no, to stop, to have to say, okay, let's go. If you have to go around the block and walk, take breaths. And so, but it's very difficult. And the other issue is there is a pension gap. You know, women, now we are women, we are working, so we have our own independence. But think about the generation before. How many of these women were at home and have not money they have low pensions, and then go to the pharmacy, and then go to do something for yourself, eat healthy food. Sometimes you have to buy unhealthy food because you don't have the money to buy the good organic food. So this is also something. It's not only biological, but it's also social. You have to address this social situation. And when you look at the pension gap in Europe, it's incredible how low are the pension for women. So this is something, it's socially, we need to, women have to have the opportunity to live, but socially supported.
Yes, well, pension, it's always the end of life.
Yeah.
But while we are still capable of delivering everything when we are at the prime, I think also we have this problem with wage gap and lack of time.
Yes.
Because we have to do more in smaller portions of time. We have careers and we have families.
Yes.
And in between, it's easier to have a snack than to prepare a meal. And when you have to prepare a meal, you prepare it for your family, but you eat on your way to work, standing and
Yes.
taking it from the side of the plate,
Absolutely.
and not thinking about checks being collected at the end of the life.
Yes. I always say health is kind of a account you have at in the bank, and you have to invest in it. If you don't invest, you find yourself without anything at the end or during your life. You have to, when we are young and we have the force and the strength to do something for us, we should take our time, because men do it, and that's right. It's not we have to say, oh look, men are doing this and they're doing wrong. They're doing very well, so we have to do the same. And we are biological, let's say, planned to live longer, but it seems like it's a fault.
Yes.
But this is not fair. If we tend to live longer, that's it. But we have to live well. So we have to pretend that the last years of our lives we have to live well. So
okay, speaking about that, and it's nice that you mentioned it. There is a thing that majority or all drugs that are being used now for stroke treatment are being tested mostly on men, white male, 60-plus-year-old patients.
Yes.
And in reality, in real life, they are being used on women of 80 and women of all colors.
Yes.
So does this have anything to do with it? How this affects the treatment? Are there any studies for women?
So this is a good point. This is in the last 5 years I'm focusing on this. Why women had been excluded. First, women are more difficult to include in the studies because to speak with the women, to convince the women, women have more fear. And again, when I say pension gap, you cannot come to the hospital to do the controls because you don't have the money to take the bus or whatsoever. So they have been excluded. And we have these drugs now for this group of patients, and I think it's a great problem because women are at 80, they are frail, they have a lot of comorbidities and so on, and we see in the real world that drugs are underdosed, but we do not know if this is right. So, for example, for the new anticoagulant drug in atrial fibrillation, we see an underdosing, especially for women, and this is a way to say we do not know if they were studied for women, so let's use them at a lower dose, but it's not. We do not know if we are doing right, because underdosing in the not correct patient leads to more ischemic complications. So still, we have to fill the gap. And now we are doing, you have this on the website, the Prestige study together with Roland Feldkamp, where my work package tries to understand which are the gaps of women not entering in the study. And I hope at the end of this study, and we will try also to do some training for women to enter in the study, we will try to improve the recruitment of women, because you have to say we need at least 50%. It's not enough 40 and 60, and especially in atrial fibrillation.
Okay. So these are all interesting things, but if we talk about women towards the end of their lives, there is also an interesting thing we found out that Safe Stroke Alliance for Europe found out from the burden of stroke, that when very difficult things happen when a man gets a stroke and when a woman gets a stroke. For a family, that is a completely different thing. And if a man, to illustrate that, if a man gets a stroke, then a woman is the one who is dropping her regular job and completely taking care of him, and dedicating her life, the rest of her life, to him. When it happens the other way around, the most often situation is that women gets been placed in a nursery home, and the man sort of continues with his life without taking this burden on. So I personally think it's not fair, and I have no idea how this can be tackled, except what you said with social measures that need to be taken, but much, much earlier, before stroke happens.
Yeah, absolutely. It's also a cultural issue, because, for example, I live in a Catholic country, so the woman is the mama, the one who should take care of this. And this is, I think, now we have to go beyond this, because now we have paternity leave, for example, when children comes to the world. Luckily, we fight for this, and we wanted this. And the same should be if there is an ill person in the family. It's not strange that a man say, I have to take care of my wife, because there is a kind of contract between in marrying something. So why should the women take the whole part of the contract? It's not fair. It's not fair. And probably even if a man want to support his wife, now it's not socially so well seen. So we have to educate, because we are the same. We are both working, we are both contributing to the society, we have often more the burden of the family. So why should not be treated as the same way?
One question, not strictly related to this topic, but also related to the treatment. Quite often, also the doctor is a man.
Yeah.
Your experience as a past president of ESO, how many women are there in the field of neurology, and are there equally represented or anywhere close to the men?
Let's say you see the future, there will be women. But now in the leading position, they are still men. And what we have a leaking pipeline. So we see at the university, 80% are women. They are better than men, because at this, women tend to study more. Then we arrive to the specialization. Specialization, the first children come, so we lose somebody. Then we go to the higher position. Then again, we lose somebody. So when we come to the high level, we have 20% of women. And this is something which is not acceptable. Medicine will become feminine, med school femme, and we need to prepare, we need to support these women to have the opportunity and the possibility, because they are brilliant, really brilliant, to go to the same level as a man, and the division of the family burden needs to be faced. It's not fair that there's a leaking pipeline for talents. These talents cannot be lost, especially in medicine. We have not enough doctors in all the countries, so we need to support these women.
Okay, now back to the prevention thing. SAFE recently launched a website, strokeprevention.info,
Yes.
and it is on that website that we will upload this conversation. So this is the only website that, to our knowledge, at the moment, having all 10 modifiable risk factors in one place. But we found that although there is a medical evidence that we can influence these risk factors, and this is not a new knowledge, still numbers of people who get stroke each year is very terrifying.
Yes, absolutely.
And currently we have around 80 million stroke survivors worldwide living with the consequences. And it's not just a stroke survivor, it's his family as well, because this is a disease that affects the whole family. So is there a way to prevent stroke? Isn't it almost impossible, because you have 10 risk factors, but they all get intersected, they interfere one with another, and how do you start reducing risk, and when do you start it, at which point of your life do you have to start with this?
So normally you say in the guidelines in the European Society of Cardiology, check your blood pressure after 45 and check your pulse after 65. So I think this is already, if you start to measure your blood pressure at 45, then you have already done, because 80% of our patients have untreated blood pressure. So blood pressure is a big risk factor. Check your pulse, atrial fibrillation. You can detect that there's atrial fibrillation. Then, when my patient comes, I look at them. I know that you have to listen to me. That I will tell you, move. Don't eat too much meat. Eat fruits. Eat vegetables. Have a nice life. Enjoy yourself. So they look at me. Okay, every doctor says to me this.
It's because it's true.
Yes, 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 yes. And try to really to walk. And then they say, "Oh, I don't feel well," and I have 20 kilos of overweight. I said, "You cannot feel well." Well, think if you're carrying 20 kilos of potatoes on your back, how can you feel? You have a lot of pain. So now you're doing this with your body, and especially of smoking. I say, smoking every part of your vessel, and for men I try to say every part of your
Yes, because they tend to pay more attention to the southern part of the blood vessels. Yes.
And I have to say that men are better. Then they listen. Women, because women smoke less, and they say, "Oh, it's only 5 cigarettes." So this is a lot of work in order to convince them.
Okay. So what I'm taking as a message from today's conversation is that women need to protect themselves better. They need to take better care of them to prevent stroke, because when stroke happens to them, it affects the whole family. And they have to do it both for themselves and for the people they love.
Yes, yes.
And there are no excuses.
No.
To live an unhealthy life.
No.
And to think, I don't have time to think about this now. I have too many things.
It will arrive.
Okay. Thank you so much for this conversation, and we hope to continue this talk.
Sure, absolutely.
Thank you.
You're welcome.